You know, as bad as things are here, I want to give you an example of a possible future that we don't want to see. I'm talking about Italy, and this is not some third world country that we're talking about. The Italian government has tightened an already strict quarantine by shuttering all bars, restaurants, as well as almost all stores. Only pharmacies and food stores remain open for business. Certain factories and farms will continue to operate, but the vast majority of Italians are now forced to work out of home, and they're only supposed to leave home to get food or medicine. People who violate the strict quarantine, they could face fine or even jail time. Now, we're also seeing a lot of unintended consequences. Scores of senior citizens totally isolated now and may have no one to check on them or even bring them food or medicine. Plus, so many people are dying that funeral homes cannot keep up. So far, more than 1,000 people have died from the virus, and that number is rising by the day. This Naples man, he lost his sister who suffered from epilepsy, and she died at home with him. He could not get anyone to take her body out of the house. Local officials told him to call the funeral home, but they said too overwhelmed to pick up the deceased. The man posted a video of himself describing the situation and describing his country, and around 10 million people have already viewed it. Hospitals, they're also totally overwhelmed there, so doctors and nurses can't tend to everyone who needs help. Basically, they're performing triage in front of the hospital. There's also not enough ventilators. And now you come stateside. There is a race against the clock as Washington tries to stop the spread of this virus. Public health officials essentially trying to flatten the coronavirus curve. This graph tells the story. If fast and effective action is not taken, we could see a steep bell curve showing a rapid rise in fatalities. The goal, it is to flatten out the curve so we can view fewer cases and obviously fewer deaths. I want to bring in my next guest, Reid Wilson, national correspondent for The Hill. He's also author of Epidemic, Ebola and the Global Scramble to Prevent the Next Killer Outbreak. Reid, thank you so much. And one of the things I got from both your book and some of your reporting is the people you spoke to have experienced in prior epidemics. They say, without exception, you have to acquire the data, you have to analyze the data, and you have to share in a transparent and honest way the findings. Can you explain to me how a month and a half after we had the warning from Asia, we're sitting here talking about tests where we haven't even done 10,000 in this country when they do more than that in a single day in South Korea? I mean, I don't know what the word is, but it's so far beyond negligence, and we still don't know where we are.
Yeah, I can't explain it to you, and your outrage is justified. I'm getting there myself. The level of incompetence that we've seen from this government is tremendous. The notion of even reinventing the test itself, when a test has already been operational in China, in South Korea, even in Italy, where they've tested 6 times as many people as have been tested in the U.S. The notion of inventing something new makes absolutely zero sense from all the lessons we learned in every previous outbreak that we've ever experienced, whether it's Ebola, whether it's HIV and AIDS, whether it's back to the Spanish flu of 1918. It's like this administration has unlearned every single lesson that previous administrations have gifted it. I mean, this is a serious national security threat. We've known that pandemics pose a serious national security threat for, 100 years, and yet we now seem less prepared than we were for the Spanish flu back in 1918. It's mind-boggling that this is happening.
But Reid, I know you know this. I just want to make sure my audience knows. The WHO handed us a functioning kit that worked, and we decided to go our own way. We produced a kit, as I understand it, that not only was giving us false positives and false negatives, but we're back to ground zero with this thing. When are we going to get these kits? I keep hearing the words, but I don't see the kits. When are we going to get these things not only mass produced, but mass distributed?
Well, they have been mass distributed, but let me tell you, the tests themselves are not the issue here. You can test all you want. You can test 1 million people today, but if you don't have the lab capability to run those tests, I mean, it's like playing baseball without a bat. What are you going to hit it with? Yep. And this is the big problem here. We're seeing more and more tests come online now, but it appears that at the moment we only have the capacity to test 18,000 tests a day, and those obviously it's not as if they're all in one central place. I mean, the state of California itself accounts for 8,000 of those tests. So if you live in a state that's not California, you've only got a 10,000 capacity. And, you know, in some of these states, the number of tests that they can run in a day is a dozen, 2 dozen, something like that. That's not going to work when the number of cases is doubling every 4 days. I spoke to the mayor of Seattle yesterday, you know, the epicenter of the American outbreak. That's my hometown. And I could hear the exhaustion in her voice. They're dealing with more than 300 cases right now. The hospital system itself is becoming overwhelmed. The mayor warned me that if they don't get resupplies soon of the personal protective gear that firefighters and police and EMTs and first responders have to use every time they come into contact with a patient, they're going to run out. So we're talking about some serious, scary stuff here. And the administration simply doesn't seem like it understands this and is moving with proper authority, proper haste to get these things into the people's hands who actually need them.
And Reid, tell me if you're hearing the same thing, but I got from certain hospital folks that they're worried about 3 things. They see what's happening in Italy, where you got patients in the hallways, those that even can get in the hospital door. They're worried about beds. They're worried, as you just said, about supplies in major ways. And they're worried about what are they going to do with their staff. They believe there's inevitabilities that the ER docs, the RNs, et cetera, they're going to get this. There's no cavalry coming up behind them, or this crazy idea you're going to bring out of retirement elderly doctors, the very target patients, you know, that, one of the folks who testified said it was the angel of death for that population. You're going to bring them in to try and replace. You get the urgency, but in the building behind you, where is the clamor here that we needed to be on this yesterday?
Oh, not yesterday, a month ago. I mean, we wasted, I was talking to the public health experts who handled the Ebola outbreak, 5, 6 years ago, and they were telling me, I mean, we've essentially wasted 6 weeks of time when we knew this thing was coming. The urgency in the administration is more about calming the markets and assuaging any notion that they bear any blame for this. There's a lot to criticize the Chinese government's response to this, but the one thing you can't criticize is they made an extra effort to spread knowledge and to spread expertise. And so they brought in people like, secretaries who were quickly trained in the donning and doffing procedure so that they could make sure that doctors got dressed properly. That's spreading expertise. That is what we need to do, not hoarding expertise or information. All epidemics are all about getting the proper information to the population so that they can practice the sorts of social distancing and just the basic practices that we need to prevent the spread of something like this. We have to act with more urgency. We haven't been doing it now. It's shameful almost that we've seen more action from the NBA and the NHL and a lot of major basketball conferences in canceling these big events than we have from governments around the country.
I try and be careful here, Reid, because I don't want to amp up what's already a growing, tangible, tense moment for so many people. But I don't see how we don't go the route, inevitably, of where they went with Wuhan and where they went in now Italy. I mean, I see Angela Merkel. She predicts 60, 70% of Germans are going to get this. You see the other numbers going around Europe as well. My point is, if you're not going to have the wherewithal on the ground to deal with this appropriately, and it seems like we're nowhere close to where we need to be, isn't there almost an inevitable point where you have to say, shut it all down?
Well, I hate to say it, but I don't think we're going to have a Major League Baseball season this year. I doubt we'll have national conventions for the Democratic or Republican parties. The Tokyo Olympics, come on, that can't really be around. That's not going to happen, realistically speaking. I'm at a complete loss for words here. This administration knew this stuff was coming. They reinvented the test. The irony is that in the Ebola outbreak 6 years ago, it was the World Health Organization that was an absolute disaster, and the CDC were the white horses who came riding to the rescue. Now it's the reverse. The WHO has a good handle on what's going on, but they're not an agency that's large enough to fight a global outbreak that's got 125,000 cases right now. They can send advisors into various places, but what does it say about the United States that we now may require World Health Organization advisors when it's the CDC that is now the government agency that's fallen down?
So, Reid, I'm going to make you the czar, whether you like the job or not. What do you do immediately, other than not letting the president get in front of a microphone and you make Fauci be the point person, what do you do? Do you almost do what we did in World War II, where you turn American industry to working to combat the problem? I mean, how do you throw men and material at this so that at least we know what we're dealing with and everybody's pulling in the same direction?
So the lessons we learned from the Ebola outbreak in West Africa are that we need to have some manner of population control. Now, that doesn't mean quarantines like they have in China. We're not China. We're not an authoritarian government, and good for us. Thank God for that. What we can do are things that they practice called microcyclage, which basically means a loose circle around communities where we're not preventing people from going in or going out. But if you do travel, make sure you're in touch with authorities. Make sure that if you do get sick, you know where you're supposed to go. We've seen some states now, Colorado and Minnesota, opening mobile testing units. That's what has happened in South Korea. That's how they've started to bend their infection curve down. We need a lot more of those in a lot more places. Obviously, this testing that the World Health Organization has is excellent. There's more capacity, lab testing capacity we can bring online. This is when the U.S. government responded to Ebola, both at home and abroad, they used what was called a whole of government approach, and that's basically every single lever of the government working towards one goal: break down all the barriers, break down all the bureaucratic red tape, just get it done. And that's what we need to do this time. We also, by the way, I should say, we also should take responsibility for ourselves. It is incumbent upon individuals around the world, around the country, to know what our role is, to prepare, to make a plan, to be home, to have the medicines that we need in as broad a supply as possible, and by the way, to check in on our neighbors. We're a deeply divided country. If there's anything good that can come from this outbreak, maybe it's that we get a little closer to our neighbors and make sure that they're safe, that they have the supplies and medicines that they need. Stay at home if you have even the tiniest cough. Wash your hands constantly. Do the things that you teach your toddler to do. We too often forget a lot of that, I think, and it's time to remember that. You mentioned Dr. Anthony Fauci, the head of the National Institute for Allergic and Infectious Diseases. I'd put him on camera every single day. That's basically what he's done in the past. He's a selfless public servant who's served in the role since the Ronald Reagan administration. He is the guy who can give the guidance without panicking people. And it's important to remember, now is not a time to panic, but it is a time to make serious preparations, to take this seriously, and to practice the sorts of social distancing that are going to solve this. In the absence of a serious federal effort here, it's going to be up to states. We've started seeing states like Washington, Oregon, California, and New York taking some serious steps. Let's see more states take those steps, more local health departments take those steps, and let's have all of ourselves take the responsibility, know how to protect ourselves, and do that to bend the curve down. The big thing that epidemiologists are talking about right now is flattening the curve. Let's make that the watchword of this entire epidemic. If the same number of people may get infected, but over a longer period of time, that's the difference between a 5 or 6% mortality rate and a 0.5% mortality rate. We can save 9/10 of the lives that are otherwise at risk just by taking those steps.
I've read a book in these last few weeks on the Spanish flu, and it is eerie how misinformation then led to so many unnecessary loss of lives, and some of the parallels to now. And then in looking at your book, how government can be basically the fulcrum and who we rely on. And anyway, you see in different chapters of American history, different times where government, if you put enough faith in it, enough resources behind it, can actually be exactly what you need. But Reid, I really appreciate the time today. Thank you so much.
You got it.
All right, everyone, we come back, we take a look at America's pocketbook. Stocks diving, Broadway closing, major sports leagues suspending their seasons. That's just for starters. After the break, the massive financial hit today, the huge disruptions that we're seeing from the coronavirus.